Clinical reasoning is at the heart of physician-assistant education. It's where students connect theoretical knowledge with real patient care, learning to think, decide, and act like clinicians. And Body Interact Virtual Patients brings that learning to life. Our redesigned PA simulation curriculum, developed with a PA faculty, is fully aligned with the NCCPA Content Blueprint and supports PANCE and PANRE readiness. Students work with life like virtual patients who talk.
It's very hard for me to catch my breath.
Breathe, and reflect real physiological changes with every action you take, practicing history-taking, physical exams, diagnosis, or treatment choices in real time. Across 160 immersive virtual patient scenarios, students progress from clinical assessment to clinical intervention and advanced clinical management.
We use it to engage learners across the full clinical spectrum. In practice, one session focused on psychiatric and behavioral health cases. Learners began individually to assess baseline knowledge, then came together in team-based learning to discuss their reasoning, debate alternative approaches, and share insights.
Use Body Interact to strengthen team-based learning, link cognitive and procedural skills by combining virtual patients with mannequins. Pause or resume scenarios to connect simulation with live instruction or self-guided remediation. Built-in analytics help you track and assess where each student excels or needs reinforcement.
We use Body Interact to help fill gaps within our clinical curriculum. We want to make sure that students, regardless of where they go on rotations, are able to experience the same type of clinical cases. We assign cases based upon what specialty they're into to make sure all students have the ability to see different varieties of cases, but see the exact same thing. Students love it. They have talked about how they have seen it on end of rotation exams, how the cases have reinforced items for their blueprint, NCCPA PANCE board exam. It becomes another patient for them.
Because great clinicians start with great training. Request a program demo today.